And so now we are very grateful that Dr. Jennifer Forrester from UC Health has joined us to talk about the variant in general and then talk about, specifically the variant in Hamilton County. So, Dr. Forrester, thank you so much for joining us. She's joining us virtually.
Hi, thanks, Commissioner, for welcoming me. I really appreciate the opportunity to get the word out and help protect our community. Thanks for all you're doing as well. So all the attention on these variants makes them seem completely alien, but really when viruses multiply or copy themselves, they make a lot of mistakes. Scientifically, these mistakes are called mutations, and this happens all the time. This is what all viruses do. Some virus mutations happen and then go away, and we don't really care about them because that mutation makes the virus less active or actually hurts the virus. But as a virus spreads and is allowed to copy more and more and therefore make more mistakes, statistically, eventually some of these virus mutations, like the ones we're concerned about, allow the virus to do its job better, to increase its survival. SARS-CoV-2, which is the virus that causes COVID-19, is a type of coronavirus, which is a group of viruses that look like they have a crown surrounding them. And that crown is made up of things called spike proteins, which is how the virus attaches to and infects human cells. The variants that you've been hearing about, the UK variant in particular, but also the South African variant, for example, have mistakes or mutations in that spike protein as well as other mutations. And what we have seen is that these variants seem to be more infectious and potentially more dangerous just kind of by the numbers, right? The more people who are infected, the more chance that someone has an adverse outcome, has more severe disease, or actually dies. Though, as Commissioner Kesterman said, there is not clear evidence that it actually causes that these variants cause more severe disease in individuals. But regardless, this is why we're concerned about them and why we're looking for them in screening for them at times. The vaccines that we currently have help our bodies make antibodies or infection-fighting molecules that recognize and attack these spike proteins. So the logical question is, what do the variants that have changes in these spike proteins mean for the efficacy of our vaccines? Well, the good news is that it appears our current vaccines still protect us against the variants that we know about now, though some may be mildly less effective than they were against the original strains. But remember, this is what viruses do. There will be more mutations as COVID-19 spreads from person to person, and probably more variants. And this is why, until a large proportion of the public is immune and protected, it's still important to continue with those practices that we know work to stop the spread of the viruses. Obviously, you've heard these. Here's the broken record: masking, social distancing, hand washing, cleaning high-touch surfaces, and then staying away from people when you're sick, getting tested if you feel sick. If the virus can't find another person to infect, then those mutations and variants can't spread. So until vaccines are more widely available, we really cannot let our guard down just yet. Continuing with our vigilance not only protects ourselves and each other from potentially serious disease, but really actually stops variants in their tracks. So what we're doing now can work, has worked, and can continue to work.
Hey, thank you. Thank you so much. Really appreciate it.